Moving on to question number 3. This question says, hey, Katie, I hope you're not tired of hearing me dance around my eating disorder behaviors, but I'm a little lost. I'm not tired of it at all. Trust me. I've been a therapist for years, been having patients do this for years. I know we are not a big fan of my online DBT therapist that I started with for self-harm, but now I'm dealing with a somewhat unhealthy game of coping skills whack-a-mole. Very common. When she says coping skills whack-a-mole, what we're referencing is like, when you try to stop doing one thing, let's say we overexercise, we try to stop doing that and then whoop, our anxiety goes up, or we try to stop self-injuring, our eating disorder behavior goes up, or we try to stop drinking and then we find ourselves dissociating more or distracting with other unhealthy coping skills, self-harm, whatever. It's kind of that like teeter totter whack-a-mole. It can feel like when we essentially what our body is saying. I think this is an important thing to note here. When we find ourselves in a coping skills whack-a-mole where it feels like no matter what we do, another one crops up. I try to stop doing this and then I'm doing that. And I try to stop drinking and then I'm self-injuring or whatever, right? When we find ourselves in that position, what that tells me is that we need more support. That means we need more therapy. We're probably constantly being triggered. When we find us trying to bring down one coping skill and another one just crops up in its place, that means that we haven't filled the void of that coping skill. We need more support. We need more ideas for healthy coping skills. And remember, it's usually 5 healthy coping skills to negate the 1 negative. I know that's annoying, but it just happens to be what I've seen. And so that just tells me we need more of those healthy coping skills and we need more support. Okay, back into the question. She says, she recently found out I have added in self-induced upper purging is what my regular therapist lets me call throwing up because it's hard for me to say. Gotcha. Needless to say, my DBT therapist said that what we were doing wasn't working. And if I wasn't willing to at least start working on the purging piece because she thinks my eating disorder has gotten huge, her words, not mine, which are not the best words for someone trying to be small, LOL. I was just thinking that. Then there wasn't anything we could do. Wow. Okay. I told her I'd be willing to try on the purging part only, but that I didn't really feel confident in my ability and had no idea how to start. She wants to only start with the upper purging, the newest piece. And my goal was to just not continue that part this week without increasing anything else. Okay, fair. She had me pick 3 healthy coping skills for the urges. Only 3. Okay. And I thought it might be easy. Yeah, no. The very hour after our session, I felt a ton of fear for some reason and alone, dangling off the edge of a cliff and expected to do a better method of climbing up than before without anyone else around to lend a hand or else be a cheerleader for me to hold on. Is this the way most eating disorder recovery starts? I wasn't successful the whole week, but definitely for a few days. That's amazing. Yes, and that is how it starts. We'll talk about that. Any advice or opinions or tips for this, or for if this is on the right track would be helpful. And I'm just so frustrated because I haven't reached my weight goal. Okay, we'll talk about that. I don't have the desire to stop, but now I should, if that makes any sense. Thanks, Katie. I feel like I'm frustrating the only 2 people, therapists, that are trying to help. You're not frustrating at all. Eating disorders are sneaky motherfuckers, and they really do everything they can to stick around because they're a coping skill. And until we heal the reason they exist or get out of the relationship that's causing it or change the situation that's triggering us, it's going to keep, our brain is still going to think that it needs to be around. Now, to your questions, okay. Is this how most eating disorder recovery starts? Talking about the not being successful, but for a couple of days, yes. The start of eating disorder recovery is essentially 2 steps forward, maybe sometimes 3 steps back. And I know that's really frustrating to hear it said like that, but it's like that sometimes at the beginning. It's why I have like a super, super old video, and maybe it's one I should revisit, but it's like, why does it get worse before it gets better sometimes? And it's because we're like directly addressing the issue. And so every urge, everything that we do is going to feel like it has like a spotlight on it, because it does, because we're trying to change the behavior. Whereas before it was kind of like autopilot and we didn't really think about it, right? We used it to numb out. We were like, and then the cycle started again. And so of course it's going to feel this way at first. Yes, that's very normal. I guess my opinions are that you're going to need more coping skills, because you said any advice or opinions for if this is on the right track. You're on the right track, yes, but you need a whack ton more coping skills. The 3 is just not going to do. We're going to need a lot of different varieties. I have an older video, the 25 coping skills video. I encourage you to check that one out. Check out the comments. There's tons of other ideas there below as well. I want you to have a mixture of those distraction-based coping skills, things like going for a walk or cleaning a part of your home or coloring or anything. I want you to have some of those. And then I want you to have some process based, like journaling, talking to your therapist, calling a friend, texting with someone, chatting in the Discord on my Patreon or anything like that. I want you to have those things available as well, because it just depends on what we're able to do at the moment. We're probably going to need, I'd say, 2 distraction techniques to every one process based, if not more right now. Okay. Distraction's okay as long as it's not hurting you or anybody else. Okay. So there's that. Then there was something where so 3 healthy coping skills. I wanted to see, not the best language, saying huge. Oh, the weight goal, your goal weight. Okay. I just want to say this so everybody can hear it. If you're struggling with any kind of eating disorder behavior, this goal weight is going to continue to change, and you'll never hit it. It'll never be enough, because even when you get to what the quote unquote weight goal was, it's going to move. I can tell you that with 100% certainty. I've never, ever, ever in my entire career working with eating disorder patients had anyone reach a weight goal and stop. Never. If you are one of those unicorns, let us know in the comments. I have never experienced that. Therefore, just know that you are going to be frustrated no matter when you try to start treatment, because you're never going to reach that goal, because the goal is going to keep changing. And that's part of what keeps your eating disorder driving your behavior, okay? And keeps you distracted, right? That's why it feels like a coping skill. It gives us something else to focus on instead of like all the chaos that's happening in our life. So just know that when I read that, I was like, oof, that's never going to happen, because it won't allow for it. Yeah. Okay. And the last little bit, I guess, my last bit of advice would be to be as honest as you can in your sessions. It's going to be hard, and you're going to feel potential embarrassment or shame or even frustration. I've had patients get angry that I'm checking in on things and I ask direct questions. But because this DBT therapist isn't in person and they're online, I just want you to do your best to try to be honest. Like, yeah, I'm having a hard time. I did it for a few days, but I fell back in. Or, oh, I still feel triggered because of this. Just do your best to be as honest as you can, because putting one foot in front of the other like that will get you somewhere good. It will help you work on your recovery, and it will help you fight back against those eating disorder urges. Okay? Hang in there. It can and will get better.